thoughts on whether it's a CNS infection? Sorry? Sensorium will change. Irritable. That is the change in sensory. There will be some symptoms or some signs which will be visible. Neck stiffness, severe headache. Vomiting. Excellent.
So I think in this child, fever and irritability have started together. So this is not an intracranial problem. In an intracranial problem, the fever and a day or two later the localization to ACNS. So when two things are together, it's not very certainly that it's not intracranial problem straight on. So meningitis is not our worry, even when there is an irritability. Again, the typical meningitis irritability is accompanied with vomiting. So if there is no vomiting, again it suggests that there is no meningitis in this child, so we can safely wait on that. Now you see further a skin rash. Now this is neither a viral infection as some of you said, and this is not a bacterial meningitis, so this is a non-infective inflammation. And if it's a non-infective inflammation,
so it could be a beginning of a Kawasaki. We have to see the other findings also.
This is Kawasaki. Okay. But the point is, a clinician could kind of justify all this statement by saying fever, irritability together, no vomiting, no meningitis. Okay. But still the irritability persists. So this is non-infective inflammation, and the most common at this age is the Kawasaki, and you would give so would you give IVIG without proof? Or at least you would want to do a 2-day echo. But 2-day echo is normal. Then would you not give IVIG?
Correct. So sir's question is, suppose you do a 2-day echo and it's normal. Will you not give IVIG?
No, we will give, sir. To avoid the complications, IVIG needs to be given.
IVIG is to be given on
Kawasaki is a clinical diagnosis.
and a strongly suspected clinically give IVIG.
Yes, so we won't wait, we will give IVIG because in 2D echo we will get the findings after 2 days. So it's an ongoing thing. In fact, not all the symptoms will evolve on day 1 itself. So fever, followed by rash, followed by lymphadenopathy, followed by strawberry duct. But strong suspicion we give IVIG because it says the right technique.
Perfect.
The classical book definition is 5 days of fever and beyond, but today even 3 days is fine. Because by 3 days you are sure it's non-infected inflammation, and that is that. One more case before we Dr. Sridhar's
Okay, so once again it's an audience poll case. So those who have not scanned the QR code, please scan the QR code. 4-year-old child presents with mild fever and dry cough. The fever settled down in the next 2 days, but the cough worsened progressively. There is a family history of similar cough in 2 other family members, and the options are symptomatic therapy, CPC, amoxiclav, and none of the above. So everybody has got the case on your mobile. Start voting. Okay, so we had a majority of the people और from Jaipur, internet अपना खराब है कि उधर का? Okay. Yeah, Jaipur, are you live. Can someone talk from Jaipur?
Yes, sir.
Yes, ma'am. Can we discuss the options in this case based on the history? Any thoughts that come to your mind?
So according to me, we can just give symptomatic treatment because fever already settled and other family members are suffering, are having the similar cough with no other symptoms of deterioration or severe infection or any condition.
Okay, okay.
I wish to ask the other people who are attending this CME if they have some
Yes.
opinion about this case.
So it is simple viral acute respiratory infection because family members also having the same problem. It is just a 2 days problem. So it is better to wait. It is symptomatic therapy.
Okay, so let's discuss it further. In a viral infection, when does the cough get better?
Normally 4-5 days, but it may takes 2 weeks also. There is nothing wrong with it. But child will be generally.
Okay, okay, fine. Okay, anyone, any thoughts here on what else it could be, or all of you are agreed that it's a viral infection? Any other thoughts? Sorry? Fantastic. There is no cold there. So that's a very strong point. It's the viral infection. Fantastic.
Virus is a generalized disease, so even in a respiratory tract, not only the running nose, but even the bronchitis. It's the whole airway is involved, even a GI is involved. So this is not a viral infection. Excellent.
So what else? Pertussis. Fantastic. Clap for everybody. There are 5, 6 answers. Okay. be careful of that. Then they have also mentioned that there is a lot of environmental heat that can cause fever. So we discussed that in the beginning, but in that 3-month-old child, depending on which area you are, you should consider whether it's environmental heat as a cause for the fever, right? So thank you Jaipur, Hyderabad, Kolhapur, Bhubaneswar, Chennai for interacting so far. We will come back to y'all and to the other centers after some time again. Meanwhile, we take a break and we ask Sridhar to do his talk. You wanted to say something?
Sir, I was just wondering, nowadays we've been having prolonged viral infections, H1N1, H3N2 and all those continue, the symptoms of cough continues for a prolonged period of time. So should we really be giving azithromycin proactively or ching them?
No, not for them. So it is important what is your original diagnosis. Here, our diagnosis is not a viral infection, it is pertussis. That's why we gave azithro. But in all those prolonged virals, when you start making a diagnosis on day 2, day 3, that this is a viral and just the cough continues, that itself is not a good reason to start an antibiotic. You just have to counsel the parents, right? Okay.
I believe till now we have been enjoying the session. I personally find it very informative. Since the first topic is almost over, and we had Dr. A.M. Kamdar, who basically was who is the chairperson for the first topic. I would request Dr. Kamdar to come up front